To increase physical activity in young people, schools have implemented standards for physical activity and physical education. Evidence shows that physical education fosters lifelong wellness and reduces risk for obesity, chronic diseases, abnormal cholesterol, hypertension, and heart disease. American Cancer Society Cancer Action Network, the American Diabetes Association, the American Heart Association all promote frequent and quality physical education in schools. Physical education needs to have students participate in health-promoting physical activities for at least half of the class period, and the other portion teach them knowledge and skills necessary for lifelong physical activity. The New York Department of Health needs to put new preventative policies and procedures in place for focusing on heart disease in non-Hispanic African American communities. One way to address this issue is to focus on socio-demographic characteristics of these communities. The inequalities of racial, ethnic minorities, and low-income families play major roles in contributing to the increase of heart disease in these communities. So access to quality healthcare services could be a barrier to receiving adequate treatment for chronic illness. To move ahead in this area will require the promotion of universal healthcare and insurance. The health department can advocate at state and federal levels to make improvements to reform the insurance payment policy in order to reward prevention. This solution has already been implemented in the Heart Health eHearts pay-for-performance program that rewards policies for every patient who meets a high standard of heart, such as hypertensive patients who have their blood pressure under control. A second policy is to promote physical activity and healthy eating in low-income urban neighborhoods with cooperation of other local organizations. The majority of these communities are surrounded by small supermarkets and fast food restaurants that lack fresh produce or healthy foods, but have an overwhelming supply of unhealthy foods high in sugars and fats. Also, in these impoverished neighborhoods, there aren't many resources to access to physical activities, such as safe and clean parks and recreational centers. The New York Health Department needs to monitor unhealthy food situation by working with food industry leaders, public agencies, and the health organizations to continue regulating the use of trans fat and salt content in food servings in restaurants in these areas. To promote physical activities within the communities, in the New York Department of Health can join with the Department of Health and Recreations and the Department of Public Transportation to ensure all members from these communities have access to safe places near their homes to be physically active. Another possible policy implementation is distributing weekly or monthly news publications focusing on education and informing the public on heart disease, prevention and treatment methods, recreational fitness events that help promote heart disease prevention, and how universal health insurance can assist those who cannot afford quality health care within these communities. Not everyone is proficient in online research and or has access to online publications. Public libraries or media centers would be great avenues to distribute these resources. This will require the collaboration of New York Department of City Planning along with the Department of Health. The stakeholders that can assist with these new policy developments will be the Department of Health and Department of Health and Mental Hygiene, DHMH, for its service to conduct community-based services through the New York City Health and Nutrition Examination Survey. This organization is responsible for collecting data for indicators in the city of New York for people suffering from chronic illnesses such as heart disease, diabetes, cancer, HIV and AIDS, and mental disorders. The Department of Parks and Recreation is responsible for public access to recreational and fitness events within the city. The American Heart Association can work in conjunction with the Department of Health and Recreation because its key purpose is to promote health free from cardiovascular disease. The Department of City Planning is responsible for promoting strategic growth, transit-oriented development, and sustainable communities in the city, in part by initiating comprehensive consensus-based planning and zoning changes for individual neighborhoods and business districts, as well as establishing policies and zoning regulations applicable citywide. In order to move forward with promoting any form of policies, a partnership is required with community leaders in the DCP before implementing any new developments. As of March 31st, 2014, the deadline for U.S. citizens to sign up for basic essential health care coverage under the Affordable Care Act was set and markets closed on this day. Now people who are uninsured will have to wait until 2015 enrollment period begins, which begins on November 15th, 2014, and ends on February 15th, 2015. This new policy is already in effect, but there are still plenty of minorities that still are without coverage. What has been tested as an effective way to further promote healthcare coverage is through the Healthy eHearts program, which rewarded practices for achieving excellent heart health in patients with financial incentives. This is a perfect solution to guarantee patients access to great quality healthcare service, but also a way to promote purchasing affordable healthcare insurance in the community and in order to receive these services. This policy should be advocated by the New York City Health Department at state and federal levels. Next is the policy to monitor trans fat, sugar, and salt content in food servings in the restaurants of these communities. The majority of those suffering from chronic illnesses are surrounded by local markets and businesses that offer food lacking in healthy, nutritional value. Combined with this policy is a plan to promote physical activity with these neighborhoods by providing the transportation to safety zones for the general public. The analysis from food safety monitoring will help determine how businesses can further analyze their serving requirements and improve the national value for each product they serve. For community physical fitness, this is a way to organize more daily, weekly, or monthly events to help encourage and inspire the public as a whole to become more active and preventative of chronic illnesses. Another policy is to distribute health publications through postal mailings, library bookshelves, or in various newsstands around the city. This is a common factor that appeals to all age groups and ethnicities. Each publication should contain articles, information on specific chronic illness, ways to seek treatment for diseases, testimonials, schedules for community fitness events, and advertising for healthcare coverage. This plan is to act as a reminder and a basic educator of chronic illnesses that have prevalence within these communities. In order to mobilize or enforce any policies or plans to assess the issue, all agencies involved must cooperate with the Department of City Planning. The agencies associated are the New York Department of Health and Mental Hygiene, which acts as chief conductor of the assessment of the issue and will advocate to state and federal agencies in support of health practices incentives. The New York City of Health Nutrition Survey, which will be collecting for data for chronic illnesses, as well as monitoring nutritional guidelines for local restaurants. The New York City Department of Recreation will work in conjunction with the American Heart Association and will give access to fitness events to the target demographic, which specifically promotes heart health. The Department of City Planning, DCP, will give confirmation on various forms of growth and development within the community that represent preventative methods to combat heart disease. The DCP will be in charge of coordinating recreational events, activities, enforcing policy and guidelines for food regulations, and establishing city or statewide distributions of monthly handheld complimentary publications that will give target communities access to information and education on how chronic diseases affect health. It will be the Department of City Planning and the Department of Health and Mental Hygiene that play more significant roles to enforce policy change. Regulating and enforcing the Healthy eHearts program is the policy to require all major EHR electronic health records clinics to offer quality and effective healthcare services. It is to ensure that patients receiving healthcare services from clinics listed within these parameters will be guaranteed superior care as they improve in cardiovascular health. The clinics offering treatment will gain incentives. It will be a win-win situation for both parties and patients and practices. As before, during the first efforts of implementing the program, the same applications such as practices, completing evaluation activities such as surveys, focus groups, and interviews will be conducted and utilized along with the new policy. The main focus is getting feedback from patients and examining how well this new plan is working for the target demographic. In order to carry out these policies, it requires a workforce that consists of individuals who are dedicated, seasoned, and have superior work ethic. They must take value in what needs to be accomplished, which is promoting the prevention of heart disease in the non-Hispanic African American communities. This workforce consists of all healthcare staff from medical secretaries at primary care clinics, doctors who specialize in cardiology, nurse practitioners, heart surgeons, and even directors of clinics and hospitals. To provide quality health assurance to the public, it requires health professionals who are competent in cross-cutting and technical skills, public health agencies with the capacity to assess and respond to community health needs, and up-to-date information systems. This is where healthcare workers are required to be trained and certified for public health preparedness in the midst of policy changes. All personnel should be evaluated on competency, knowledge, and applications of new health initiatives. Overall, in New York, cardiovascular disease occurs more frequently among the non-Hispanic African Americans than other populations. Non-Hispanic African Americans die at a rate of 244.5 per 100,000, compared to 206.6 per 100,000 in Caucasians because of cardiovascular disease. Identifying that there is an increased rate of cardiovascular disease in non-Hispanic African Americans is the first step to solving the health disparities of this community. Then, public health has to diagnose and understand why this population experienced this disease in higher numbers than other populations, including risk factors and potential health hazards of the community. Factors that are more specific to this population are socioeconomic status, lack of education, lack of healthy food choices, physical inactivity, and lack of insurance. By taking into account the risk factors of challenges of non-Hispanic African Americans in New York, while creating education and programs, the population will be better informed and be empowered with information because the education is centered on their specific situation. Community partnerships among the American Heart Association, the New York Department of Health, and the Department of City Planning will mobilize the proper individuals and groups to address things such as increasing areas for physical activity and improving the availability of health food in urban areas. In addition, these groups need to continue to support initiatives like smoking bans and increasing the nutritional value in food to improve the health of non-Hispanic African Americans in New York. By applying the Health eHearts program, distributing educational health publications, promoting physical activity for communities, and monitoring food guidelines by setting regulations for restaurants and businesses, the state of New York will officially be moving forward in the fight to prevent heart disease. Citizens will be taking more responsibility of their own health, and they will also be combating heart disease as a community effort and becoming accountability partners for each other. As new policies come into effect and results are analyzed and evaluated, then the Department of Health and Mental Hygiene will consider researching for new insights and solutions to improve what has already been implemented. According to the CDC, between 2008 and 2010, the average rate of heart disease deaths for adults aged 35 and up in the state of New York were an average of 306.3 per 100,000. With the new policies and plans in place, New York can greatly reduce these mortality rates, hopefully by 50% within the next 2 years as a result of making these changes in the target communities alone. The healthcare system is always evolving and changing. New ideas and policies take time to research and study, but with increased knowledge with the issue and increase of cardiovascular disease in African Americans in New York comes the ability to effect positive changes in health outcomes.